Welcome to the Wednesday, June 2nd, COVID-19 response media briefing. I'm Frangie Mays, your facilitator for this event. I'd like to welcome our panel for today. From the Washington State Department of Health, we have Dr. Umair A. Shah, Secretary of Health, Michelle Roberts, Acting Assistant Secretary for the Division of Prevention and Community Health, Lacey Fehrenbach, Deputy Secretary for the COVID-19 response, Dr. Scott Lindquist, Acting State Health Officer, and from the Pacific Islander Community Association of Washington, we have Joseph Saya, Executive Director. To begin today's briefing, we'll open with remarks from Secretary Umair Shah.
Great, thank you, Frangie. Sorry for looking down there. I was getting a message right as we were beginning. So I want to just start by saying thank you to everybody for joining us, all of our media partners. And I want to just say good morning to everybody. I know that this is a commemoration of Pride Month, and we want to also at DOH recognize the absolute diversity of our all of our state of Washington and our support for LGBTQ communities throughout our state. We absolutely recognize the role that they play as part of our amazing fabric for the state of Washington and certainly in communities across the state, as well as recognize the public health role in addressing inequities, including health inequities. And I really just want to recognize again Pride Month, and I know Governor Inslee yesterday also made commemoration of this, and I wanted to also acknowledge that as well. DOH remains committed to working on issues related to health inequities, no matter who they involve throughout the state of Washington. And certainly we want to continue to work with our partners on the ground. This has been an important week for all of us in Washington. As we all know, we commemorated Memorial Day just a couple of days ago, and really recognizing the fact that this Friday will mark the 500-day mark since we began responding to COVID-19 in the state. Let me pause for just a moment and just say that 500 days is a long time. 500 days is an incredibly extended and sustained response to any type of emergency. And all of us in public health have been through so many different emergencies, but really recognizing that 500 days for a singular crisis such as COVID-19 is really speaks volumes to the arduous work that everyone across the state in the public sector, the private sector, at the state level, local level, and throughout at the community level have had to endure during this very difficult crisis. But the good news is we're seeing light at the end of the tunnel, and we know that there are going to be challenges that will continue. We're by no stretch of the imagination out of the woods, but we hope the days are ahead of us are better, especially thanks to vaccines. And this is really critical to the work that we are doing, as we know that our path forward was to get vaccinations to our populations throughout the state of Washington. And I will want to say that we made amazing progress in that regard, yet we can't make that progress continue unless all of us are in this together. Vaccines remain our path forward. We've made, as I said, tremendous progress, and I'm going to be sharing some of those numbers, but we still worry that there are far too many people who are eligible who could get vaccinated who have still not gotten vaccinated, and that is something that all of us should be concerned about. For example, we have 71% of our seniors 65 years of age and above who are vaccinated, but that still means that there are many seniors who have not gotten vaccinated, and we want to continue to encourage all seniors who are eligible and able to get vaccine to be able to get vaccinated. We also know that there are clusters or pockets across Washington of people who have not gotten vaccinated for one reason or another, even though we know it protects them and they know it protects them. The vaccines work, they're effective, they're safe, but it ultimately is about everybody working together. We know the last mile is also going to be very challenging. In fact, it may be most challenging. We want everyone who can receive vaccine to get vaccine. And again, now is the time to do that. Getting vaccinated has never been easier than it is now. We want to make sure that the vaccine choice is the easy choice, that it's the right choice. And now is the time to take advantage of convenient drive-through, pop-up, and mobile options, which I know we've described over the last several media sessions as well. If I could have our team bring up the first slide. And this is just a reminder. I think some of us forget this because it's been so long since we've had these discussions related to vaccines and vaccine administration in the state of Washington. But again, it really comes down to the three-legged stool of supply, logistics, and demand. And if you remember very early on, we at Department of Health had said, yes, supply is what everybody is focused on right now. We want to make sure that the logistics are strong, that we're able to administer vaccine throughout the state of Washington. But our biggest concern over time was going to be in demand. And demand has really softened, and it has dropped off in many parts of the state. And we want to make sure that that demand is still there, such that we are getting adequate vaccine coverage for the state of Washington. We have made a big push for vaccination as we approach the June 30th reopening date. And as you can see here, as you all will recall, the governor has set forth June 30th as the date for reopening, unless we can get to more than 70% or get to 70% of our population 16 years of age or above having received at least one dose. So we have more than 62% thus far who have received at least one dose in this population group. That's almost 3.8 million people, but we certainly are not at or near our 70% mark yet. Making progress, but again, not there still. As of May 30th, we had more than 3.3 million people in Washington who are fully vaccinated, which represents now over 50% of the population over 16 years of age and above. And it's just an incredible testament. If you think about this, 3.3 million people who are fully vaccinated, we're absolutely making progress. We're absolutely getting ourselves to the goals that we want to get to. But again, we need to continue to keep the momentum going. The next slide shows that more than 7 million doses of COVID-19 vaccine have been administered in the state. And again, this is just an incredible testament to the hard work of all of our partners on the ground. I just want to really, again, just recognize the efforts of everybody working together. Again, 7 million doses is no small feat, and we could not have done this alone, but we continue to need to sustain that momentum. If I can show the final slide in the slide deck here. We are also looking at what population level immunity looks like for our state. And as you can see here, when you add in prior infection plus vaccination, we have around 44% of Washingtonians who are protected in some way from COVID-19 because of either, again, prior infection or vaccination as of May 20th. And again, you can see in the graph here that we are making progress more from the standpoint of vaccinations than it is prior or current infections, and that's good. We want that to be the way it is, that we do not want to see an increase in the people who are infected. We want to see an increase in the people who are vaccinated. So again, this just speaks to the incredible work that's happening on the ground to get vaccines to people no matter where they are. As I mentioned a bit last week about the new initiative that we were going to launch, and we have actually launched this now. It's called the Caravan concept, and this is a new mobile vaccination effort with community partners and local health that the Department of Health has now launched. And we actually went into full effect starting June 1st, starting yesterday, and we are increasingly moving forward with efforts. We're going to build and layer upon the work that's already started through mid-June and late June, and really I just can't say enough to our Department of Health team and all of our partners for the work that has gone into creating the caravan concept. This is really designed to increase vaccine access for priority communities. It absolutely has an equity focus, but it also allows us to be more nimble and more mobile in our efforts. The priorities will include counties with higher race or ethnicity gaps, more vulnerability or disproportionately impacted communities, sectors with recent outbreaks, and geographic locations that have not received a caravan visit and or even have other mobile vaccine efforts in those communities. Let me make it very clear that we know that many of our local health departments and jurisdictions and other partners on the ground within the hospital and healthcare system and our other clinics and public sector are doing so many different efforts so that they can also have mobile vaccine capabilities, and we are supplementing and complementing that work. Groups can request a caravan visit at events that they may have upcoming, whether it's a faith-based event, whether it's a community event, whether it's an event where people are just gathering for some fun, and we want to make sure that we're also a part of that fun. This is the first ever capability at Department of Health for this. And again, I just want to recognize both the concept of caravan, the concept of health in motion, the concept of really being on the go, and the concept of being nimble about how we approach our work in the community. We do believe that this is not just for COVID-19 and COVID-19 vaccinations, but our work really in promoting health and well-being throughout the state of Washington in future weeks, months, and even years. And so I'm just really proud of this effort, really excited about this effort, and I just want to give so much kudos to all of our Department of Health team for getting this off the ground as we launch this initiative. Very exciting, and it's an exciting initiative that we know is going to bear fruit for really helping Washingtonians get vaccinated. If I can also now focus on a few of the disease trends that we know continue to move in the right direction as we approach the reopening date. I know Lacey Fehrenbach and Dr. Scott Lindquist are on, and I know both of them can speak to if there are any questions on any of the trends that I speak of. We've had almost 437,000 confirmed and probable cases of COVID-19 to date and almost 5,800 deaths. So while we have made progress, we do recognize that this has been a very difficult road thus far. As you can see here in the epi curve, that cases continue to decline statewide. Hospital admissions are also declining, though just a tad bit slower than they were in early May. Beds occupied by COVID-19 patients are starting to decline, but are still higher than we would like to see statewide. We do have some regional variation that our team can speak about if you have questions about that. But as you can see, this what we were looking at as the fourth wave. This fourth wave has had the increase, and fortunately it has not been sustained, and it has actually now started to decrease, and we continue to be hopeful that that remains the case. On the next slide, I want to again go back to this slide that we showed a few weeks ago. We have some updated numbers, and again, as we estimate hospital admission rates in those that are aged 45 to 64 who have not been vaccinated versus those who are fully protected, the difference in that red line, which again represents unvaccinated, from the green line, which represents fully vaccinated, is a 21 times increase hospital admission rate. So that's a 21 times increase that is if you are unvaccinated being hospitalized versus being vaccinated who are hospitalized. And this ratio is 13 to 1 amongst the 65 years of age and above population. And that corresponds to vaccines thus far being 92% effective in really corralling and diminishing the risk for hospitalizations from COVID-19. So that's fantastic news. And what I wanted to really say that we want to keep these trends that are on track and moving in the direction. We know we need to continue our vaccination efforts and precautions, especially for those who are not vaccinated, like masking and distancing. We want to also remind everybody about respecting the rules of the room. We've made it very clear, whether it's an establishment or a jurisdiction, if they are asking or requesting or requiring you to wear a mask when you are in the establishment or in that jurisdiction, we want you to respect the rules of the room and be doing that. We also do, as we talked about last week, we do not want people to be shamed from wearing masks. If people feel more comfortable wearing masks, even if they are vaccinated, we would certainly want people to respect that as well. What we do not want to see, and this is a concern of mine in particular, is I do not want to see a tale of two societies, that we have one society that is vaccinated fully and protected fully and going about its business in a manner that all the different activities that we are usually engaged in are now able to be done with protection and without as much concern for COVID-19. And yet we also have another society where people are not vaccinated, and those individuals are still trying to go about those activities as the vaccinated people are, but they are at risk. They are at risk for COVID-19 transmission, and COVID-19 infection. And as we showed in the graph that I just talked about, we are very concerned about those who are unvaccinated increasingly being a proportion of those who are hospitalized. And so we want to make sure everybody is doing whatever they can to get themselves vaccinated if they have not, and also to help a family member, a friend, a coworker, somebody who's a neighbor, or some other community member to get vaccinated as well. Let me close by saying that a reminder that beyond June 30th, we still need to respect the rules of the room you're in when it comes to masking and other efforts. On June 30th, business restrictions will likely be lifted, if not sooner, and most public spaces will be able to return to full or fuller capacity, depending on what the case may be. And certainly we hope that that can be done sooner, given where we are with our vaccination numbers. And again, we're at 62% now, when we're looking at the 70% mark as being the end goalpost that we're trying to get to sooner than June 30th. Mask orders will remain in place. They'll still be required for unvaccinated people statewide. But again, we're going to continue to follow guidance and the science and the evidence and the information that comes out from our federal partners, whatever happens and develops from our science and evidence in the literature, and what we also recognize is good public health knowledge and public health practice in order to protect Washingtonians from this horrific pandemic. We made immense progress thus far because we have been working together, and really working together is the highlighted aspect of why we are here today and what we have been doing together to be able to promote the health and well-being, not just for ourselves and our families, but those around us, and ultimately for our communities. I want to say thank you to Washingtonians. Keep up the great work. You're doing a fantastic work. For those who have not been vaccinated, please get vaccinated. Do not hesitate. Vaccinate today. And also to our providers, keep doing everything you can to encourage people to come in for vaccinations, to answer questions, and to be able to make the vaccine choice, the easy choice, the right choice, and the healthy choice. And with that, I want to say thank you to our media partners, and we'll be open for some additional questions, and I will turn it back to you, Frangie.
Thank you, Secretary Shaw. Next, we'll go to Assistant Secretary Michelle Roberts.
Well, good morning, everybody, and thank you, Secretary Shaw. I'm Michelle Roberts, and I lead the COVID-19 vaccine planning and distribution team for the Department of Health. So time is flying by. 6 months ago this month, we got our first COVID vaccine delivery in Washington. Since then, we've made so much progress. More than 7 million doses of life-saving vaccine have been given out across our state. More than half of all people 16 and older are fully vaccinated and protected from this disease. and 62% of people 16 and older have gotten their first shot. So thank you. Most of us are going out and doing what we can to protect our communities. 3 weeks ago, 12 to 15-year-olds became eligible for the COVID-19 vaccine. Can we get the slide up, please? Since then, more than 105,000 12 to 15-year-olds have received their first dose of Pfizer vaccine. This is over 25% of that age group. This group, including my own daughter, will start receiving their second doses this week. The school year is just about over and summer vacation is right around the corner. Soon these kids will be fully vaccinated, which means they'll be able to fully enjoy summer break, and us parents will have one less thing to worry about. Our kids will be able to get back to doing the things they love, spending time with friends and family, which is what we want for everyone. If you get your first dose this week, you'll be fully vaccinated by early July and be able to enjoy the summer safely, those 4th of July barbecues, and time with friends and mask-free in most places. Another piece of news, the good news. This week, Moderna asked the FDA for full approval of its COVID-19 vaccine. This vaccine is currently under an emergency use authorization, which was granted in December. Since then, more than 120 million doses of the Moderna vaccine have been given out across the country. Full approval requires at least 6 months of safety data. Last month, Pfizer became the first COVID-19 vaccine maker to request full approval. We do not know yet how long FDA will take to review these data before they make a decision, but it's really positive progress that these applications have been completed and submitted to the FDA. Finally, I want to start by saying thank you to everyone who has helped out at our state-led mass vaccination sites. In just 4 months, those sites gave out more than 303,000 doses of COVID-19 vaccine. As we close this chapter of our vaccination efforts, we're excited to expand more in our mobile units and continue to get people vaccinated all across our state. Really working hard to bring vaccine where people are and making it convenient and easy for people to be vaccinated. If anyone has a question about the COVID-19 vaccine, please visit DOH's Frequently Asked Questions page or talk with your healthcare provider. To make a vaccine appointment today, visit our vaccine locator website, text your zip code to GetVax, which is 438-829, to receive addresses or nearby sites, or you can call our COVID-19 vaccination number, 833-VAX-HELP. Thank you.
Thank you, Assistant Secretary Roberts. Next, we'll go to Executive Director Joseph Saya.
Yeah, thank you to the Department of Health team for welcoming me and having me as a guest speaker. Ta'alufalava. Joseph here, Executive Director of the Pacific Islander Community Association. So as folks might know from the data disaggregation for Native Hawaiians and Pacific Islanders, the COVID pandemic was a very different pandemic for us due to the hospitalization rates at 11 times, the death rates at 6 times, the rates of compared to whites. And so we know that COVID has been very devastating for Pacific families, and there has been a tremendous mourning in Pacific Islander communities throughout the states. But I come here very hopeful because I think at the beginning of COVID pandemic, Pacific Islander peoples knew that, we have this saying in our culture, which means that we steward our own health, right? That for any communities to really be well, they have to have sovereignty over the choices and the health systems that do steward the health of their peoples. And so with that in mind, a lot of our Pacific Islander coalitions and communities have been very activated around equity as far as testing, as far as vaccinations, when the vaccinations did come out. And so the good sign is when Pacific Islanders are galvanized to vaccinate their communities, you have vaccination rates that is 71%, like for example, in King County, right? Which is tremendous, which is unknown of in the country because of the access and the partnerships that Pacific Islander organizations have leveraged with DOH, with public health, and also healthcare providers, where they were able to really lean into the best practices of Pacific Pacific Islander community leaders and their CBOs to really vaccinate our populations that have complex, very complex issues, right? From not being insured, from all of the ways that linguistic barriers are stood up, that our folks are not able to access vaccine. So you compare this, and I think Dr. Shah puts it best. We don't want a society, we don't want to have two societies, right? So we know vaccination rates are at 71% in King County. You look at our rural communities, Pacific Islanders in Clark, in Spokane, in Snohomish, and places that don't have as much access, right? We're looking at vaccination rates at 20 to 30%, which is pretty dismal. And so we know that, and with Pacific Islander people, we are not well until we're all well. We're very much an extended community and network of people. And we know that our relatives in rural communities also must have the access to vaccination in order for them to be well. And so partnerships where Pacific Islanders are really leading the vaccination process, as far as registration, as far as walk-ins, as far as our people registering our own people and being paid to register and vaccinate our own people, have been tremendous in really supporting us in getting higher vaccination rates for Native Hawaiians and Pacific Islanders. We also know that data disaggregation is huge for our communities, and so all of the work that the Department of Health and County Public Health has done to disaggregate Native Hawaiian and Pacific Islander data has been tremendous, so that we do see the disparities, and we are looking at strategizing at the level of the community level that we need to in order to support our Pacific Islander peoples. And so it's been tremendous. We know also from a national survey that we participated in that Pacific Islanders in the ages between 18 and 44, 43% of them have vaccine hesitation. And so, we've always been about vaccinating our elders, but now we're shifting towards really encouraging younger Pacific Islanders to really join us in this effort towards really stopping the deaths that is happening in our community, stopping the hospitalization that is happening in our communities, and really shift us to a post-pandemic wellness status. We do at the Pacific Islander Community Association, we do food distributions. We also provide rental assistance. We also provide a vaccination toolkit in 12 different Pacific Islander languages. And so if there are healthcare providers, community members, church members that are wanting more information about the vaccines, please go on our website, www.picawa.org, and we'd be able to share that critical tool that is translated in 12 different languages so that folks can really start to understand the science behind the vaccine, but told from a Pacific Islander perspective. Just want to thank folks for giving me the opportunity to share this morning.
Thank you, Director Saya. Well, this brings us to the Q&A segment of today's briefing. We do have several media with questions today. If we're not able to get to your question, please reach out to us at doh-pio@doh.wa.gov. Our first question today comes from Key with the Bellingham Herald.
Hi, can you hear me?
We can, go ahead.
Okay, thank you for taking the time to continue to inform us. I live in Whatcom County, and it is one of the counties that where we are starting to see a tale of two societies. There are pockets of our community that are still unvaccinated, and our hospitalizations remain a bit high. And I was calling to find out, or my question is the State Department of Health concerned about what they're seeing in terms of cases and hospitalizations in Whatcom County? And what specifically can be done to encourage folks who aren't vaccinated yet? Thank you.
So thanks for that question, and I'll just take a very high level response to it, and I'm going to actually kick it over to Dr. Lindquist and Lacey for specifics about Whatcom County, and also maybe Michelle when it comes to the efforts to reach populations that have not gotten vaccinated thus far. The high level, and the reason that I say a tale of two societies is that we are recognizing that we're seeing throughout the state of Washington, but this is really a national phenomenon where we are seeing across the country those who are vaccinated, who are, again, being able to get back to some level of normalcy of activities, not completely so, but some level of normalcy, and be protected. And the concern that we have is that those who are unvaccinated may have a false sense of reassurance that when they see others around them perhaps not having a mask on or partaking in activities, they may incorrectly assume that that goes for everyone, but that really goes for those who are vaccinated and protected, and not for those who are unvaccinated and thereby continue to be unprotected. And so this is what the concern is, not just in a Whatcom County or in one part of our state or throughout our state, but it's really throughout the country. A tale of two societies that ultimately is something that we need to really get our arms around, because we do need to continue to work with everyone, including our media partners, to champion the messages for why vaccines really help us get out of this pandemic. And ultimately, that's what all of us want to do and want to see happen. So with that, let me turn it to Scott and Lacey for the Whatcom County specifics. And then Michelle, if you wanted to add anything about efforts to reach harder to reach population.
Yeah, I can start. I mean, to answer your question directly, yes, we are concerned about Whatcom County, as with some other counties in Washington State where the hospitalization rates are very high. And we're very concerned about it for this reason. Like, we just went through Memorial Day weekend. As more people are out boating or hiking, biking, doing things outdoors, and traumas are occurring, if the hospitals are full, it's going to be very hard to get these folks in. So the hospitalizations in Whatcom are not all due to COVID. There has been an increase in hospitalizations around the state that are non-COVID related. A lot of it could be people that have put off surgeries, that part of that is getting into the hospital post-surgery, and also other hospitalizations due to non-COVID issues. And Whatcom is having that problem. We just reviewed all this data on last Friday with all the local health jurisdictions, had a good look at the hospitalization trends. And I think the answer to your question, which is what can we do about this to help get people vaccinated? Because Dr. Shaw gave you those statistics of the vaccination. For those that are unvaccinated, the hospitalization rates are higher. It's just a simple fact. So I think the media really portraying this and showing how the hospitals are full, how you're more likely to be hospitalized if you're unvaccinated, really should make a compelling story. Now, in the last week, I've had probably a dozen people, as I'm explaining this to them, actually go about getting their vaccinations because they're realizing this is a risk to the community, it's a risk to the hospitalization rates, and they've watched enough of the vaccination to see it's safe, it's effective, and they're turning to this. So I think that letting the public know about that is probably the single most important thing we can do to really encourage people to get vaccinated. And Lacey, if you have anything else to add?
No, I think we can move on to Michelle in the interest of time on the vaccine piece.
Yeah, I'll just add, this is a really good example of what Dr. Shaw was talking about. Whatcom's vaccination rates really are right there with the state averages. So there is a lot of vaccination happening, but we always know that vaccination is not even across any geographic area. So there could be pockets of neighborhoods or families or groups that come together where vaccination rates are lower, and that's really what creates the risk. We've seen this with infectious diseases. Well, we see it every year with infectious diseases, whether it's influenza vaccination outbreaks, occasional measles outbreaks in our state. So our work really is to make sure that we are bringing vaccinations to where people are. We are understanding what questions and concerns people have. We're partnering with our community-based organizations, like we had Pika on here today, who really know their communities best and know what questions and concerns and can reach people in ways with the right languages and that are culturally appropriate. And the other thing we can do, we all need to reach out. We need to talk to our family and friends about why you're being vaccinated if you are. We need to ask if somebody needs help getting to a vaccine appointment, whether that's getting an appointment scheduled, whether it is getting a ride there. There's all kinds of things we can do to help each other and better protect our communities. So it will take all of us, and it will take time to make sure that everybody has access to vaccine. And the last piece I'll say is our businesses play a role, especially our employers. So can they give paid time off for people to be vaccinated? We have a coworker who told me a story about helping a business she went into, one of the employees who works 6 days a week. So there's a lot of privilege in those of us who already have paid time off or have sick time in case we have side effects. So I think our businesses really need to be thinking about how can they help their employees be vaccinated, and do they have some of those safety nets in place, like paid time off or other, what do people know how they can take some time if they do have side effects for the vaccine for a day or so. So those are some of the things we all need to keep doing to make sure we don't have pockets of where people are unvaccinated. And this disease is smart, this virus is smart, and it will find those pockets and continue to spread.
All right, our next question comes from Joey with the Everett Herald.
Hi, thanks for taking the question. Looking at the state's 7-day average for vaccinations, obviously with the shift away from mass sites going around across Washington, it was going to drop. Looking at it now, do you think it's realistic that we'd hit the 70% of adults before June 30th? And then at the same time, it's looking like some of the sort of equity issues that we're seeing early on are starting to level out. Is that being seen statewide as well?
Joey, I'll just mention that the Caravan initiative is very much focused on the concern for equity throughout the state of Washington. And so I think that is absolutely why we're hopeful that we've made a lot of progress. You know, we're very proud of the fact that our state has not just been looking at the numbers and the quantity of vaccines, but also looking at the equity concerns throughout this pandemic, and certainly during the vaccination process. So I'm really, it's a source of some level of solace for us that we are seeing some improvements. But then again, as you heard from our colleague here with our Pacific Islander Community Center, that there is still a lot of work to be done, and this is not a destination, it's a journey, and we're still in the midst of that. Let me turn to Lacey for that question. I think Lacey can talk a little bit. We had some discussions about where we are with the 70% and 62% and trying to get there. So Lacey, if you could speak more to that, and then Joseph, I don't know if you wanted to make any additional comments related to the Pacific Islander community and equity.
Thanks for the question. To answer, currently, based on the number of adult people 16 and older that are initiating vaccine on a daily basis, we would be pretty close to the June 30th, either just before or just after. I do want to make sure it's crystal clear to the public, we absolutely have the capacity and the supply to advance early or reopen the economy early. We need more people, and there are more people who are not vaccinated in that 16 and older category to step forward and take the vaccine. So as some of the panelists mentioned earlier, if you know someone who has not yet been vaccinated, talk to them about it, point them to trusted information, encourage them to talk to their healthcare provider, get them a ride. If they need a ride, they can also arrange a ride through our hotline. So that is available as well. And certainly, if you are an employer, consider ways that you can support your employees in getting vaccinated. we absolutely can do this, Washington, but we're on pace to be at the June 30th date right now.
Yeah, and to the equity question, Joey, that you posed, we know that COVID just illuminated for folks how systemic racism plagues our healthcare systems and our public health response as well. So it's probably going to take maybe a decade to really focus on really closing that gap, right? And we also know that community health clinics is like a cornerstone of recovery, especially as we are looking at the Native American community, and their vaccination response has been tremendous because of a lot of the work of Native community health clinics. And we know that that is something that other communities like the Latinx community, Black communities, Pacific Islander communities really have to account to really be a part of the health interventions for over the health of our communities moving forward, right? And that takes years to build, and also just really good partnerships with public health and also healthcare providers to mitigate equity. So yeah, we didn't achieve equity at all, and probably won't for a while. So it's an ongoing battle, but I think we're all committed and at the table to do the work.
All right, our next question comes from Ariel with the spokesman.
Great, thank you. I'm curious if the majority of positive cases, hospitalizations, and deaths now are in people who are not vaccinated, and if so, sort of when we started to see that shift, and does it differ by region?
Ariel, that's a great question. I don't know if it's the majority as of yet. Lacey or Scott might have some additional detail. I know we received your question, and we're actually now doing some additional analysis based on that question. And so we're hopeful that we're going to be able to have some additional information. Don't quite have it yet, but Scott or Lacey, do you guys have any additional insights?
Yeah, Ariel, I would say, since the very beginning, unvaccinated folks drove the pandemic because no one had a vaccine, right? So most of the hospitalizations, all the deaths were in people that were unvaccinated. What we're starting to see is a difference between hospitalizations for sure in those that are vaccinated and those that are not. So, Dr. Shah gave those numbers earlier, especially for the 45 to 64-year-olds, the vaccination rate is tenfold, if not greater, based on vaccination status. And we got your question. We are pulling it to look at deaths and regions, and hang tight and we'll give you that information as we get it. But clearly we are moving away from everyone being unvaccinated to those that are being vaccinated, and showing us glimpses at decreased death, decreased hospitalization, and decreased infection and outbreaks.
All right, our next question comes from Steve with Como.
Hi, thanks very much for taking my question. I have two questions for you. One is we were looking at some of the latest census survey data yesterday, and some of the top reasons why folks in the state are saying they're not planning to get the vaccines have to come down with possible side effects, waiting to see if they're safe, don't trust the vaccines, that sort of thing. Does the state have any data on how many people have actually suffered severe side effects after getting the shots? So I'm wondering if those numbers might help slow down some of those fears or address some of those fears. And the other question I have is, realistically, what is the timeline for when younger kids can get vaccinated, so under the age of 12, and how important is that in the overall health of the state in the midst of the pandemic?
Yeah, thanks, Steve. Let me take the second question and have Michelle answer your first question. When it comes to our ability to vaccinate under the age of 12, we are hopeful that over the next several weeks to a couple months that we will begin to see some more movement of the approval when it comes to pediatric vaccines for under the age of 12. And so our hope is, and again, this is really a hope, that by the time that the school year begins in the fall, that there would be the ability of being able to vaccinate a younger population. Again, it's speculation because there are a lot of things that have to happen, including the phase 3 trial completion for that population, but thus far it does look promising. So that is one piece of this, and why that's important, obviously, is that we want to make sure that we are not. We talked about a tale of two societies. We also don't want to have a tale of two families, where the parents or those who are 12 years of age and above can get vaccinated and can go about doing their business protected. And as I mentioned many times before, I've got 3 kids, and 11-year-old, 7-year-old, and 4-year-old, and none of them are eligible to be vaccinated right now. And therefore, when we are out and about, we still have to be thinking about their health and safety, and be very differential in the way we approach things, because we know that while we may be able to go into a certain establishment without a mask on, for example, they cannot, and they're still at risk. And that is something that obviously is of concern. So I do think having a pediatric addition to the arsenal for vaccinations for younger kids is going to be very helpful for parents and families, and certainly for the children that are involved. Michelle, did you want to answer the first question when it comes to the hesitancy or confidence?
Yeah, I just first want to make sure everybody knows it's normal to have questions and concerns about getting a vaccine. So this is a health behavior that we need people to decide for themselves. And that's why we recommend talking with a trusted healthcare provider, why it's really important we're working with community-based organizations like PICA and others who are trusted voices in their communities and who have that family caregiving or community caregiving relationship that Joseph talked about. And why we really encourage healthcare providers to routinely bring this up. It may likely need, from we know from other vaccines, multiple conversations to help somebody feel recommended. And so providers need to make sure they're asking about vaccination status, and then they're saying, let me see what questions you have, and I'm going to keep talking with you about this because I know it's the best decision for your protection. But if you're not ready today, we'll talk about it next time I see you. So those are some of the really important strategies. I think as far as what do we know about vaccine side effects, there is information, and we can point to you where it is in our website, that we are sharing with the data that CDC's collected from the Vaccine Adverse Event Reporting System. And anybody can actually go to their website to see what has been reported. VAERS is, so the system is called VAERS, for Vaccine Adverse Event Reporting System. It is a safety signal system. It's not definitive. We really work to encourage anybody who's had a potential side effect from the vaccine to report to it, whether or not for sure it was caused by the vaccine. But it can really help us see kind of a level of what are people feeling like they're experiencing, and what do we know about rare side effects. So which are serious side effects are rare, but it is not uncommon to have maybe not feel good for a day or two after vaccine. And that's another really important place about, and I've heard worries from people who aren't vaccinated yet, like what if I only have a day off of work? What if I don't feel good? What if I don't live by myself? And do I have a caregiver who can help me? And so those are the important things where we need employers thinking about that, where we need people checking in with their family and neighbors to make sure that our community can support everybody being vaccinated.
All right, our next question comes from Nicole with Cairo Radio.
Good morning. Thank you for taking my question. Could you give an update on the breakthrough cases and breakthrough deaths in Washington? I'm wondering if the people who have died from breakthrough cases were already immunocompromised, or is this something that's happening also in young, healthy people, kind of trying to get an idea of why that's happening? And do you get any sense that Washington is having a higher level of breakthrough cases than other states, or are we just testing more?
Scott?
Yeah, so the overview on breakthrough, the quick answer is no, we're seeing what is expected given the vaccine efficacy and what vaccines are given. We've been alongside with CDC, checking this since the very beginning because we expected breakthrough cases. So we're not seeing anything above what we expected. Yes, we are one of the top 3 states in genotyping. So no matter whether you're genotyping positive cases or breakthrough cases, we are doing more than almost every other state. And so, yes, we are picking up. And the trends that we're picking up from that is it is a good mix of all the variants that looks roughly like the variants from all positive. So we're not seeing basically a predominance of one variant breaking through the vaccine. So the other thing we're seeing is it's a fairly equal split amongst age groups. There's no predominance of any specific age group. We know that about 75% of these people have symptoms. So 25% are without symptoms that are picked up during routine testing of outbreaks. And so we're picking up quite a bit of breakthrough through our aggressive outbreak testing. And 9% of these breakthroughs have been hospitalized. We understand that. So they can be ill. It's not that they're all mild. As far as the deaths go, the majority of these are older and they have underlying health conditions from age. So that is not unexpected. So the bottom line from our breakthrough is, yes, we're being very aggressive about testing and looking for it. And yes, we are finding what we expect. We don't appear to be out of the ordinary. And that's where we sit. Again, this will be ongoing. I would really turn you to the outbreak report. There's a public report that's created that will be posted to our webpage today. And so I really encourage you to look at that and read through it.
All right, our next question comes from Jessamine with Q13.
Good morning, and thank you very much for taking my question today. I had a question, well, two really. There was a report coming off of some Johns Hopkins data that was published in USA Today about the 73% surge. I know there's a lag in data, especially considering the holiday weekend, but as we're looking at the numbers that you showed earlier, it looks like cases are going down, but a 73% surge. I just wanted to see if you could put that number in perspective, and specifically when it comes to the numbers in Pierce County, which had according to the latest numbers, quite a rise.
Well, I'm going to ask Lacey to weigh in on this. I do think that one of the challenges that we've had is that when you look at overall statewide numbers, then, you do sometimes mask what's happening in certain communities, certain counties. And so while overall you may see improvements and trends that are getting better, the concern is that you may have clusters and certain parts of the state where you do have whether it's maybe flattening or maybe not as robust of a decrease, or even frankly an increase. And that is something just is the challenge when you have statewide information. But again, overall, we're making market amount of improvement. We believe that improvement is quite frankly related to vaccines. And there is such an incredibly important message here to our communities, which is get vaccinated, because that's really how you can protect yourself and ultimately those around you. Lacey, did you want to add anything to that?
I think you covered it well, Jessamine. There is a lot of variability across the state in terms of disease levels. If you look at the 14-day case rate, it ranges from the 20s at the low end, so 20 cases per 100,000 over a 14-day period in the counties with the lowest rates to, 300 or 400 cases per 100,000 over 14 days for counties on the higher end. And I think the other really important thing to note is even within counties, there is variability, and we will keep seeing this challenge of reaching the communities that have not been vaccinated to help get them and their community protected. And we will continue to see disease in communities that are not vaccinated. So we're at this critical, really focused effort to reach those parts of the state geographically, those communities, whether it's a big geography or a very focused community within a county. That is where this response is going to turn going forward.
All right, our final question comes from Kayla with King 5.
Hi. Okay, so the city of Bonnie Lake just passed a resolution banning vaccine passports from being used or asked for, saying that asking for proof of vaccination is a form of discrimination. I was just curious what the Department of Health's take on this is in terms of discrimination with asking for proof of vaccination.
I'm not aware of Bonnie Lake taking that stance, and we'll certainly have our team look at that. And I will say that in general, we want to do everything we can. I think I made it very clear that our Department of Health stance has been around incentivizing and encouraging, doing everything we can to encourage people to get vaccinated. And certainly we do know that when entities, whether it's business establishments or a restaurant or a concert hall or a local health jurisdiction, are having to then operationalize that, that's where it becomes really hard. And so really having the ability to somehow verify or somehow being able to check a vaccine status is important. I don't think it goes as far as the allegation here about discrimination. I do think it really gets to more about how do we really truly protect people. If you know that somebody is vaccinated, they're protected. I think that's been the theme throughout this press briefing, is if you're vaccinated, you're protected. If you're not vaccinated, you're not protected. Unfortunately, when you have vaccinated and unvaccinated together, that's where you also have potential for risk. And so we want to do everything we can to encourage people to get vaccinated. But I'm not aware of that specific ordinance or whatever it was that you've referred to, but our team can certainly look at it. I don't know if anybody else on our team has any additional comments about this one.
I'll just add that a lot of people and a lot of federal rules and agencies have been cleared that asking about someone's vaccination status is not discrimination, is in fact allowed. So our own Department of Labor and Industries has guidance on this. The U.S. Equal Employment Opportunity Commission has guidance on this as well. So it is not discrimination to ask about somebody's vaccination status. And in fact, in our here in our own country and in everywhere, we've had a long history of asking about vaccination status for public health. So that includes in our school settings, it includes the authority that local health has for disease investigation. If there is outbreaks of disease, to find out who is protected in those settings and require people to either stay home or not be in those settings if they're not protected. So that's just a little basis about kind of the long history of public health and public health authorities. And I'm really glad that some of our federal partners have really dug in and put out some good guidance, as well as our own Department of Labor and Industries.
All right, this concludes the question and answer segment of our briefing today. And now we'll go to Secretary Shaw for closing remarks.
Thanks, Frangie. I just wanted to, before I made my remarks, if Joseph had anything that he wanted to say. He went off camera. I think he's still here. Just anything, I just wanted to thank you and the efforts of your team and really serving not just your community, but beyond your community. I just want to say thank you. And if there's anything you wanted to close with, and then I can make a couple remarks.
Yeah, thank you, Dr. Shah. Just, really appreciate the true commitment to equity that the Department of Health has, and really partnering effectively with our CBOs that are working on closing the race equity gap, right, in healthcare services, healthcare insurance, healthcare access, and all of that. And so, just my hats off to you, Shah, and team, Roberts, and Fehrenbach, and also Dr. Linguist. Thank you all for the partnership. And I know that this isn't, it's not going to end this year. So we're going to be seeing each other for the next few years, and whatever other things come on our horizon. So appreciate it. Thank you.
Thank you, Joseph. Thank you for being part of this briefing. I again want to just remind everybody that as we get closer and closer to June 30th, our focus remains on vaccinations, and we are hopeful that we're going to be able to reach the 70% mark before June 30th, but it's going to take all of us to be able to do that. In the meantime, we want everybody to continue to respect the rules of the room that you're in, whether that's the establishment or the jurisdiction. We know that this Friday commemorates, and we're 2 days away from that, commemorates 500 days of response to COVID-19 in the state, an incredible amount of work across all levels of government and partners in the private sector and our healthcare sector. And I know people are legitimately tired and tired of this pandemic, and yet this pandemic isn't tired of us if we do not get vaccinated and we do not take the appropriate precautions. So it's going to be really up to us, and hopefully we get to the June 30th we get to the 70% mark before June 30th. That is really what we're all focused on. And we do believe the Caravan initiative that we've launched starting yesterday is really going to be an incredible addition to the efforts that are out there. And we want to make sure that community groups, again, remember how they can actually request a caravan in their community event that may be upcoming. And with that, I just want to thank all of you, again, our media partners. I've said it every week. Can't do it without you. You help champion those messages from us to our community members. Thank you for everything you've done. I know we're at 498 days, but you've been with us throughout those 498 days, and it really takes a village. And so I want to thank all of you for everything that you continue to help us with championing those messages. And with that, thank you to our team that's been on this broadcast now, and certainly Joseph for joining with us. And with that, I'll turn it back to you, Frangie.
Well, this concludes today's media availability. I'd like to thank our panelists for their time today and TVW for hosting today's live stream and archives of past briefings. Thank you all, and take care.